Do they have the testing they need right now to make sure people are not sick, are not putting others at risk, as they now plan for a phased-in reopening? President Trump speaking just moments ago on this, and 24 hours after saying he has a good relationship with governors, Democrats, and Republicans, the president now encouraging protesters in several states who want their states to reopen now. Groups gathering, authorities concerned many without masks. The president signaling out key election states, Michigan, Virginia, Minnesota. Michigan's governor, her message to protesters tonight, it's better to be 6 feet apart than 6 feet under. And tonight, as some parts of the country still brace for the peak in New York, where there's been a flattening of the curve, still more than 600 dead in one day. Masks now required if you're out in public in New York. And Governor Andrew Cuomo firing back at President Trump. Also tonight, the horror unfolding for some of the most vulnerable in nursing homes and senior centers in New Jersey, New York, Massachusetts. And tonight we've learned 6 people have died after attending the same funeral. The desperate need for food in this country, and tonight here we have the stories behind the faces. We're in one line where cars began arriving yesterday afternoon. So many in need, some in tears. The father who told us he doesn't know what to say when his children ask what's for dinner tonight. And the woman who waited 18 hours for food. The new results just in tonight, Diane Sawyer reporting on a major antibody study in one county in America and what it reveals about just how many in the community may have been exposed to coronavirus. Far more people than first thought. And the scientists telling Diane this may be the tip of the iceberg. The race tonight for any kind of treatment that works, and the drug already being used, remdesivir, could it hold promise? Tonight, one patient saying he showed immediate improvement. He'd been on oxygen. And after so much talk about chloroquine and hydroxychloroquine, that study that was halted. And we asked Dr. Anthony Fauci, where does the U.S. stand on this right now? And in China tonight, the death toll in Wuhan revised up dramatically, as the World Health Organization now says tonight that they do not have proof that antibodies will provide you with immunity.
This is ABC World News Tonight with David Muir.
Good evening, and we have just about made it through another week here together, and it was another trying week in America, the deadliest since this crisis began, with New York reaching its peak, leveling out, but at an awful level. Another 600 people dead in just the last 24 hours. Massachusetts, for example, hitting their peak just now. And governors across the country must now decide how and when to slowly reopen their states. The president speaking late today on all of this. And we take note of the numbers tonight, the lives lost. More than 36,000 people lost, doubling in a week. And on the front lines, the battle against the virus rages on in so many parts of this country. You can see there the EMTs in protective gear hosed off, being decontaminated after transporting suspected COVID patients. That's in Yonkers, New York. The fast-moving investigation into at least one nursing home, but the toll on so many senior centers across this country, residents passing away with no one from their family at their side. And we wanted to hear the stories tonight behind the faces, the family members in those long lines across the country, and you will be moved by the families who never thought they would have to ask for food. This line here in San Antonio. And now tonight, the war of words erupting. Just 24 hours after the president said governors would make that call, he is now encouraging protesters in several states. Evening, Governor Cuomo lashing out after the president took aim at some governors. ABC's Whit Johnson leading us off here in New York.
Tonight, at the end of the deadliest week for our country, a heavy toll on the front lines. EMTs in full protective gear transporting suspected COVID patients, then decontaminating their suits only to do it again.
Since this happened, I haven't been able to sleep with the lights off. I sleep with my lights on.
For New York paramedic Elizabeth Bonilla, a relentless cycle delivering painful news.
This is when it's hard. It's real hard. So young kids, youngest boy is 3, and you can't do nothing.
In New York, at least 630 people dying in a single day.
You're not going to hear any day soon, it's over, the nightmare ends, and we wake up. It's going to be incremental, and we have to be smart as we do this.
In neighboring New Jersey, more than 3,800 lives lost, the death toll nearly doubling since last week.
This is now more than 5 times the number of New Jerseyans we lost on 9/11.
The pandemic killing senior citizens in nursing homes at an alarming rate. 55 residents dying at this one home in Brooklyn. In New Jersey, 40% of all COVID deaths are in nursing homes. In Massachusetts, it's 50%. Across the country, thousands like Berna Lee cut off from their family members, feeling helpless.
I know she's fighting, and I just need her to know I'm fighting for her.
But amid tragedy, there is triumph. Janet Mendez could barely breathe when she was brought to Mount Sinai Morningside Hospital nearly a month ago. She was told she would be put on a ventilator.
I had less than 20 minutes to say goodbye to everybody.
But now she's going home. That high five for the doctor who helped save her life. Tonight, many states now looking for their next steps too. In Las Vegas, where the famed Strip lies empty, the mayor pleading to reopen.
I fear that we're going to have deaths caused by people just throwing their hands up. I can't handle this anymore.
Today, Texas Governor Greg Abbott becoming one of the first to announce plans to reopen some stores next week, but only for curbside pickups, no customers inside.
We must put health and safety first.
It's been 24 hours since President Trump announced guidelines for reopening the country, applauding his relationships with governors of both parties, saying they would call the shots. Today, he egged on protesters defying stay-at-home orders in several states with Democratic governors, states that will be key to his re-election.
They listen to me. They seem to be protesters that like me.
Michigan's governor with a warning.
It's better to be 6 feet apart right now than 6 feet under it.
Hours later, the president tweeting out, "Liberate Michigan, liberate Minnesota and Virginia." He also took aim at New York's governor, who has pleaded for federal help to expand crucial testing.
Is there any funding so I can do these things that you want us to do? No. That is passing the buck without passing the bucks.
The president was watching and tweeted Cuomo should spend more time doing and less time complaining.
First of all, if he's sitting home watching TV, maybe he should get up and go to work, right?
Cuomo also had no use for the president's claim he should be more thankful for the federal help New York has received.
You want me to say thank you? Thank you for doing your job. Thank you for participating in a modicum of federal responsibility in a national crisis.
Whit Johnson back with us at the top of the broadcast tonight. So many governors now across the country sounding the alarm, Whit, saying there's simply not enough testing for families to get back out into society, to go back to work, to send the kids back to school. And we took note late today that the Vice President, Mike Pence, in a new interview, saying there is, quote, a significant amount of unused testing capacity in this country. It would sound like he says there's testing available, even as we know there are complaints in several parts of the country that there are not enough tests.
And David, in that interview, the vice president said the administration has no higher priority than expanded testing right now. And that unused testing capacity that you just mentioned, Pence said is something that could be activated, potentially doubling the amount of tests taking place in this country every day. David.
All right, Whit Johnson leading us off tonight. Whit, thank you. And as we have been reporting here with those new numbers late this week, now at least 22 million Americans have now lost their jobs since this all started. Tonight, the Americans, the parents in line for food, the father who told us he doesn't know what to say to the children when they ask what's for dinner. ABC's Marcus Moore with those families in line in San Antonio.
Thank you. God bless you all. These are the faces of hunger and their voices.
My name is Krista Flores. I'm furloughed from my job, single mom.
Disabled, and I never thought of needing help. My name is Hannah Hendricks. Unfortunately, my unemployment did get denied.
I've never really needed the assistance before.
As the deadly pandemic grips the country, this week marks 1 month without income for millions of Americans. In San Antonio, an army of volunteers from the food bank working through the night, packing trucks with groceries.
This pandemic has forced so many to get help simply to feed their families, and this is what that desperation looks like. A line of cars filling this stadium parking lot.
There you go.
Many are like Matthew Serna, who was laid off from his warehouse job at the start of the shutdown. He's utilizing the food bank for the first time ever to feed his 3 teenage kids.
It's not easy to ask for help. Nobody likes it when your kids ask what's for dinner and you're not sure what to tell them.
Beatrice Ortiz was the first car in line. She waited 18 hours to get this food, reading the Bible to pass the time. She is no less grateful for the nourishment, the peace of mind loaded into the trunk of her car.
Thank you for the San Antonio Food Bank and for all the essential workers doing their jobs, because without them, where would we all be?
I'm just proud of our staff for such sacrifices. They're the finest human beings I have the privilege of working with.
All those families extraordinarily brave to not only get in line for that food, but to share their stories with you tonight. Marcus back with us live from San Antonio. And I know we were struck when you were reporting in all day, Marcus, that you told us many of these families told you that they have never had to ask for food before.
Yeah, David, 2,000 people came here to get food today, and a majority of them, 70% of them, we are told, were first-time visitors to the food bank. They have never before needed to ask for this kind of help. And David, it was a surreal sight in this parking lot.
Marcus Moore tonight. We appreciate those stories, and we will stay on this every night. There are new results in tonight in the World Health Organization this evening saying it does not have proof that the presence of antibodies means you'll have immunity from this, even though that, of course, is the hope. They'll continue to study that. What we do know, though, is that those antibodies show if you've been exposed to the virus, and there's also new results in on that. Diane Sawyer is back this evening with a major antibody study in one county right here in America, and what it could reveal about just how many of us in that community have been exposed to the virus, and far more people than first thought. What will it say about the rest of the country now? What the scientists leading the study are telling Diane tonight.
The results are in from 3,300 volunteers tested in Santa Clara, California. Just a finger prick, a drop of blood, which reveals if you have antibodies left behind because you had the coronavirus.
I am so excited to talk to you. What can you tell us about what you found?
Dr. Eran Ben David of Stanford says at the time he did the testing, official records showed 1,000 cases of the virus in their county. But he says the study of the antibodies indicates the estimated number could be up to 80,000.
Is that more or less than you expected?
Our findings suggest that there are about somewhere between 50 and 85-fold more infections in our county than what's known by the number of cases, than are reported by our Department of Public Health. What we're seeing is the tip of a big iceberg.
He says it will take more research to know how many people with those antibodies never knew they had the virus because they had no symptoms. And here's a reality check. Even if as many as 80,000 people in Santa Clara have the antibodies, that's less than 5% of the total population there. So even if the antibodies offer meaningful protection, 95% of their population could be vulnerable, returning to schools or to jobs or to life.
We don't know if this confers immunity. We don't know if you still are or if this is really a past infection, if you're currently infectious. The most important thing is to keep following the public health guidelines.
Tests from one community, another study underway in Los Angeles, and reporting in soon.
When we first talked, you told me that this was kind of a mission for you and your team to show that we can gather information. We don't have to wait to gather information. Do you still feel that way?
Oh, absolutely. And I mean, even more so.
And at the very least, these scientists have shown it's possible to move quickly and carefully and get some real information right now.
Diane Sawyer reporting in tonight. Diane, thank you. And I know as soon as you learn more, you're going to bring it to us. In the meantime, there's also a race tonight for any kind of treatment that works. And the drug already being used, could it hold promise? Tonight, one patient saying he showed immediate improvement. He'd been on oxygen. And after so much talk about another drug, chloroquine and hydroxychloroquine, that study halted in Brazil. And so we asked Dr. Anthony Fauci, where does the U.S. stand on this right now? Here's Alex Perez.
Tonight, a new media report says doctors at the University of Chicago are hopeful that a drug once tested for Ebola shows promise for rapid recovery in some COVID-19 patients. Slawomir Michalak says he's one of them. He was hospitalized with severe pain, high fever, and put on oxygen when doctors gave him the drug.
Then my body started to recover. I had no more high fever, and then from day one, I didn't get any more medicine to reduce my temperature.
He was home recovering in just 4 days. Nearly all of the 113 patients with severe symptoms were reportedly given remdesivir and have since been taken off ventilators or discharged. 2 of the patients have died. Researchers urging caution, saying the report offers a small snapshot of a wider study involving more than 100 locations and shouldn't be used to draw conclusions. The drug, just one of at least 30 in clinical trials, including hydroxychloroquine, often touted by the president.
I think it could be something really incredible.
But there are concerns about hydroxychloroquine's safety. A study in Brazil halted after signs of adverse effects on the heart. Here in the U.S., studies underway. David pressing Dr. Anthony Fauci on where the trials stand.
You had said weeks back that there was no scientific proof that this, in fact, was working. It's a drug mentioned by the president often in recent weeks. Where do we stand on that right now?
Well, there are still no clinical trials that definitively show it works or does not work. There are a number of clinical trials that are ongoing, and hopefully we'll get an answer to this question that's very much on the mind of a lot of people.
And David, officials here say what we're seeing on remdesivir is only partial data. The trial is not yet complete, so they say it's simply too soon to draw any conclusions. David?
Providing some hope, but as you say, more study is needed. Alex, thank you. And overseas tonight, China is out with new numbers this evening, a dramatic rise in the death toll there. Here's ABC's James Longman.
Tonight, China is revising up the death toll in Wuhan by 50%. After repeated criticism that the true numbers have been suppressed, Beijing now claims data from funeral homes and prisons has brought the total number of deaths in the city to almost 4,000. President Trump quick to respond on Twitter, saying it is far higher than that and far higher than the US, not even close. There have been over 34,000 deaths in the United States. Meanwhile, the World Health Organization today announced that they'd contacted British and French leaders and America's Bill Gates to explore how to get vaccines from labs to people as quickly as possible in the future. It comes just days after President Trump said he would halt US funding of the WHO, saying it had mismanaged the crisis. In an exclusive interview with David this week, Bill and wife Melinda Gates said that would be a mistake.
Do you agree with that move?
Well, I'm hopeful that he doesn't follow through on that.
WHO was created after World War II to deal with exactly these kinds of issues around the world. So halting funding right now, that just doesn't make any sense.
David, it's no wonder, given tensions with the White House over funding, that the World Health Organization is looking elsewhere for help. The Gates have now pledged $250 million to the fight. David?
All right, James Longman, our thanks to you again tonight. When we come back, your question.